My name is Ryan. I'm a content manager for Kaplan's NGN prep initiatives, and I'm excited to discuss how to answer cloze items. What is a cloze item anyway? A cloze item is one in which you will fill in the blank. The word cloze is derived from the word closure. There will be a sentence or several sentences that will have a blank, and you will choose from a drop-down list or pull words from a list to fill in the blank. You will choose the best word or phrase to fill each space. Let's review our objectives. During this video, we will look at examples and discuss 3 types of cloze questions, including how each type of cloze item is scored. The 3 types of cloze items that we will discuss are cloze dropdown table, and cloze dropdown rationale. I will also provide you with some tips and strategies to think about as you answer cloze questions. This is a cloze dropdown item. There is typically 1 to 5 sentences with 1 dropdown in each sentence. To populate the answer choices, place the cursor on the first dropdown, labeled with the instruction select beside an inverted triangle, and left-click with the cursor. 3 to 5 options can appear in each dropdown. Each sentence with the dropdown can be viewed similar to a traditional multiple-choice question. This particular cloze question contains 2 independent dropdowns, 1 per sentence. Remember, you will have information in the form of case-based medical record tabs for NGN questions, so you will have the background information you need to complete these sentences. You will select the best word or phrase to complete each sentence. Cloze dropdown items follow the traditional 0-1 scoring rule, in which you earn 1 point for each correct response, but do not receive points for incorrect responses. The sum of all correct responses is the total score for the item. The minimum number of points for a question is 0. In other words, you cannot receive a negative score. If there are 2 dropdowns in total, then the entire question is worth 2 points. If you do not select the correct answer, you do not receive a point for that dropdown. Each dropdown is scored independently. After making your selections, pause and ask yourself, do my answers make sense? Have I selected answers based on my foundational nursing knowledge? Have I selected answers based on the client's priority problem or condition? Here is a second type of cloze item, a cloze drop-down table in which information is completed within a table or chart. This doesn't really complete a sentence, but it does complete missing information in a table. Cloze drop-down table items also follow the 0-1 scoring rule. For each row in the table, there will be a drop-down, and you will need to select the best response. 3 to 5 options can appear in each dropdown. Each row is worth 1 point. This particular question is worth a total of 3 points. Here's another cloze item. It looks nearly identical to the first cloze dropdown question that we looked at. However, this is a cloze dropdown rationale item. In a cloze dropdown rationale item, there is a relationship between the dropdowns. Due to, or as evidenced by, is written in the question stem. The question may have 1 cause and 1 effect, or 1 cause and 2 effects. After recognizing and analyzing cues from the medical record portion to determine the priority concern, with each answer option in dropdowns 2 and 3, ask yourself, does the answer choice help validate the priority problem or potential condition identified for the client? Unlike cloze dropdown and cloze dropdown table, cloze dropdown rationale items are scored using the rationale scoring rule. The rationale scoring rule awards points when both elements of a linked pair of concepts are correct. This scoring rule tests concepts that require justification through a rationale, that is, situations in which a nurse must identify the condition X because of circumstance or symptom Y. Per the rationale scoring rule, you earn 1 point when both X and Y are correct. You earn 0 points when any element of the answer selection is incorrect. If a closed drop-down rationale item has a total of 2 drop-downs, then the entire question is worth a maximum of 1 point. If a closed drop-down rationale item has a total of 3 drop-downs, then the entire item is worth a maximum of 2 points. The example on the screen has 1 cause and 2 effects, 3 drop-downs in total, so this particular question is worth a maximum of 2 points. In order to receive any points on this question, you must provide the correct answer in the first drop-down. In other words, you must first be able to correctly state the priority concern for the client, or recognize the condition the client is most likely experiencing, depending on how the question is written. When you answer a closed drop-down rationale item, there is 1 sentence and there is a relationship among the blanks. Remember, it can be X due to Y, or X due to Y and Z, or X as evidenced by Y, or X as evidenced by Y and Z. You need to determine what X is first, and that will help you choose Y and or Z. In this example, the option chosen for X was dehydration. Now you will look at the next 2 drop-downs and determine which options support dehydration. Dehydration as evidenced by what? The medical record tab information in the case study will give you the necessary context to make that decision. Let's recap rationale scoring. Remember, it's all about the relationship. You must identify X, which will be the condition or what is going on with the client. Then turn your attention to what supports or correlates with X. Rationale scoring rule states that you must correctly identify the first drop-down in order to get any credit for the other responses. If the question is X due to Y, the question is worth 1 point. If the question is X due to Y and Z, the question is worth 2 points. I hope these examples and tips are helpful for you. When you take tests in the study plan, you will have a scoring guide that will help you with each of the question types. And Kaplan has many Cloze items for you to practice with.